Hi, my name is Joan Melton. I'm a nurse practitioner at Harrison County Hospital. Today I wanted to talk to you about the differences between the COVID-19 virus, the common cold, seasonal allergies, and the flu. We are in the middle of the COVID-19 pandemic, and then we're also at the end of the flu season and the beginning of the allergy season, which occurs usually in early spring. And then the common cold, which we see all year long. So I wanted to kind of help you out and distinguish between each of these four viruses to give you some ideas of what symptoms that you should monitor for and to help you distinguish between the four. COVID-19, first of all, is the novel virus that we are dealing with now. It's new and it has symptoms that are developing and we're learning about. The three common symptoms or hallmarks that we talk about include the dry cough and a temperature of over 100 and also some shortness of breath. Now the symptoms can vary from very mild to severe to even life-threatening. Other symptoms that some people have described and is associated with this virus is the loss of appetite and the loss of the sense of smell. You can also have some body aches and headaches, extreme fatigue. You can have some diarrhea even. People have talked about that. You will not have the symptoms of a runny nose or sneezing or stuffy nose with the COVID virus. Now the COVID virus usually occurs within 2 days up to 14 days of exposure and can last anywhere from 7 days to 23 days plus. If you're concerned about the symptoms and you're not sure, you need to contact your healthcare provider. Now, the seasonal allergies, which happen usually early spring, like I said, and begin in March to April when the pollen count and the ragweed count and the grass count go up. Now, the severity of the symptoms, again, can vary depending on how allergic you are to these allergens. Usually, seasonal allergies will last for weeks. And they do include the sneezing, runny nose, stuffy nose that you don't see with the COVID virus. You can have a dry cough sometimes, particularly if you also have asthma. You can usually treat this with antihistamines and allergy injections, they do not usually cause a fever, and they do not cause body aches and diarrhea, and most of the time you won't get shortness of breath with just allergy symptoms, regular allergy symptoms. So the difference you can tell is that allergy symptoms are more in your upper respiratory with the watery eyes, runny nose, stuffy head. The cold, the common cold, or it's also called the viral rhinitis, that has similar symptoms to allergies sometimes, and it usually lasts though less than 2 weeks, and it usually will go away by itself. You can take care of yourself by drinking lots of fluids, getting lots of rest. You can take over-the-counter cold remedies, but most of the time the symptoms are a mild cough. You'll have some body aches. You'll also have some sneezing and runny nose. Maybe a low-grade fever, maybe some sore throat and tiredness, and a mild headache. But you will not have shortness of breath with the common cold, and you will not have any diarrhea. The best way to protect yourself from all of these that I'm going to be talking about is, of course, washing your hands on a regular basis. Now, we've talked about the COVID-19 and the seasonal allergies and the common cold. Just to make a point about all of these actually, and even the flu, which I'll be talking about, is that they can trigger asthma attacks, any kind of infection like this, upper respiratory or viral infections. And asthma attacks can lead to wheezing and shortness of breath. Asthma attacks, though, can be treated and usually reversed with medications. COVID-19, however, is the only one by itself that causes the shortness of breath, and it is usually in the more severe cases, and also it can lead to the point of needing to be hospitalized and even possibly intubated. The other illnesses will not be that severe. The influenza, which we do have a nice rapid test for, which is beneficial for us to help diagnose it. It usually occurs abruptly also and may last for 1 to 2 weeks. You will have fever usually between 100 to 102, lasting for 3 or 4 days, the fever. You'll also have a dry cough with this, and a headache, body aches, fatigue. And sometimes you might also have the stuffy nose, runny nose, and sore throat with the flu, but you won't have the shortness of breath and you won't have any sneezing with the flu. Some children that have the flu also may have some diarrhea. Usually the type A flu is a little bit more symptomatic than the type B, and we can test for both of those. So in closing, I just want to tell you that, remember, the best way to prevent from contracting any of these viruses is to wash your hands frequently and to avoid close contact with anyone who may be ill. So stay safe and be sure to contact your healthcare providers if you have any further questions about symptoms that you may have. Thanks.